Hey there, Sage. How are you doing today?
I'm doing great, thanks.
Wonderful. Well, thank you everyone here for attending this LinkedIn Live with myself. I'm Michaela Bowling. I'm the co-founder of Brilliant Marketing, and we have Sage here with us today as well. So today we'd really like to talk about kind of nonprofit communications, and especially talking about one of the coolest nonprofits that we've worked with, and they're in Seattle, which is Lifelong. And really exciting, they're celebrating a 40-year anniversary this year and have really helped to break down barriers to health for some of the most marginalized communities in Seattle who are really battling illness and health injustice. So Sage, you are the Director of Engagement at Lifelong, and I'd love for you just to start us off by just kind of telling us a little bit about you.
Wonderful. Well, thank you for having me. And I've been at Lifelong for a little over 14 years now, overseeing all of our engagement efforts internally and externally. I manage our fundraising, agency events, marketing and communications, as well as our volunteer department. And I'd have to say my favorite part of my role is being able to build relationships at all levels of the organization. So with our clients, our wonderful staff, and the community. And I just really love hearing why Lifelong's mission is so important to people and how I can leverage that experience to grow our positive impact in the community.
I love that because you are such a connector and a relationship builder. Brilliant Marketing worked with you all the last year on some social media and some donor research, and it was really cool. We got to go to your office or your warehouse and actually see where you're making all these amazing meals, and it is just really wild. Like, you are such a force of having all these different connections and with the volunteers and other people on your staff. So it's really special to see that. Okay, well, I would love to know a little bit about the evolution of Lifelong. It's been around for 40 years, serving the community for 40 years. And I think it's such an interesting story about how you all started and how you've evolved, and really could be like a good lesson for other nonprofits who are kind of going through different transitions.
Yeah, no, we have such a legacy in the community, and we're really proud of that. And I'm proud to be a part of that. But our roots are really in the AIDS epidemic. And we were forged by a handful of Seattle community members who were outraged by the stigma and lack of care services and funding for people affected by the disease. And out of their activism came two local organizations, Northwest AIDS Foundation and Chicken Soup Brigade. And the foundation really worked on the advocacy efforts and services like case management and housing, while Chicken Soup Brigade focused on, a lot with their name, getting food to people who really needed it, as well as driving folks to medical appointments, and that real day-to-day hands-on support for people who were so often stigmatized and really sadly left to die alone. Thankfully, medications came on the scenes in the 90s and changed the course of the disease for the better. Lifelong, the agency we are today, was originally or officially formed from the merger of Northwest AIDS Foundation and Chicken Soup Brigade. They really wanted to combine their resources so they could best serve the community's evolving needs. And over our expansion really began with our food program. Chicken Soup Brigade, in its earliest beginnings, was just trying to get calories into the people who were wasting away from AIDS. And that really changed with medications and treatment. And in turn, we really evolved our production into medically tailored meals. And all of these meals are specifically tailored to meet the needs of those living with a disease. The drug regimen that clients were taking for their HIV was just much better adhered to with healthy food. And then over the years, other disease-based organizations that were local asked us to make meals that were tailored to a variety of illnesses, specifically like kidney disease, so that it could really help have the same wonderful effect that it did for those that were living with HIV. And so today, Chicken Soup Brigade specifically serves home-delivered, medically tailored meals that are nutritious and culturally relevant, as well as groceries. And most of our clients are homebound. Many are seniors. Everybody is low income and living with a variety of chronic health conditions such as HIV, kidney disease, cancers, cancers and diabetes. And over time, we've seen that our comprehensive care model of really meeting somebody where they're at, eliminating that stigma, looking at what their strengths are and how we can help leverage those, we knew that we could bring more equitable access and resources to people living with a broad range of illnesses. And so we officially expanded our mission probably about over a decade ago to serve all the community members who are living with that dual burden of both poverty and illness.
Yeah. I love that story because it's like the two separate organizations coming together, like evolving to then form one organization and kind of having to figure that out. And then really focusing on one illness, HIV, building that model for that care model. And then now expanding that to even more people. So it's really cool how you've evolved and then kind of kept up on the trends of what's going on in the community.
Yeah.
How do you think, as from a communication standpoint, how has that communication message had to evolve? And was that difficult to kind of tell your donors in the community how that evolution is happening?
Sure, that has been a challenge. In the early 80s and 90s, the messaging was really focused on activism and awareness around the injustice that these communities who were affected by the disease were facing by the various systems that should have been the first line of defense to support them. And people were so angry, and they were really rallying in every form to find ways to inform and activate their legislators, their government, and funders to take immediate action, towards allocating money and care services for these people who were not getting the urgent attention, that was desperately needed. Thankfully, huge steps forward have been made over the past 4 decades around HIV testing and treatment, care and prevention. And Lifelong, like so many other organizations that started or, continue to be serving the HIV community, have evolved to meet the current community health needs. And for us in our state and within our broader King County, for HIV, it's bringing attention with messaging to the fact that while HIV rates have decreased in Washington, compared to the height of the epidemic, the people we are seeing be infected at a disproportionate rate today are BIPAC communities and the trans community. And we're working with other partner organizations to help address those unique barriers that these communities face. And then with our expanded mission, our messaging really focuses now around health disparities as a whole and how we can utilize that really unique model of care to reach our most marginalized neighbors, who still are not given an equal opportunity to live their best health and thrive.
Yeah, definitely. I think that's what makes you all so unique too. So yeah, well, talk to me a little bit about, in the evolution that's happened. We did last year, we helped you with some of the donor research. What was kind of the impetus for wanting that donor research? Why was that kind of the right time?
Sure. Well, as we continued to evolve as an organization and still are, we've also seen an evolution of our donors and supporters. And so with a decreased sense of urgency with the AIDS pandemic, and again, thankfully, but donors began to shift their support and their attention to other issues that were emerging. And Lifelong was continuing to do amazing work in the community, but we were struggling to message how we were still relevant to HIV and community health as a whole. And so fast forward to this last year, we were transitioning into having a wonderful new CEO and expanding our outreach, geographically. And so we knew it was a crucial time to learn in a more strategic way what was connecting our current donors and supporters to our mission and who were they? Because it's really been difficult over the years to, especially with the pandemic, the COVID pandemic, to be able to connect and get to know through in-person opportunities or even be able to reach out to them. So we couldn't plan our next steps without being able to know what was important for our audience to hear and how did they want to be engaged.
Right. Yeah. I want to explain a little bit about the research that we did, but first just want to say, you know, one of the things I love about Lifelong is some of the creative events that you have put on and how that was really hard during COVID to be able to figure out how to do that. So like the gay bingo is one of my favorite ones. Very cool. That happens in July. Is that correct?
This year we have one in June and in December as well to honor World AIDS Day.
Oh, very cool. Well, yes, very, very cool events. And then you also do the dining out for life as well, partnering with the different restaurants to be able to raise money for your cause as well. So that's a really, really cool event as well. But yeah, to go back to the research part, just to explain a little bit to everyone what we did for Lifelong is we kind of did two types of research. We did a series of kind of 30-minute interviews with donors. So more of that kind of qualitative research to really see, you know, kind of what was the persona, what were the different people who are these people and what do they want? What are some of the feedback that they have? And then we also did a survey to their donors through social media and an email list that we put out and had just a Google form with some of those questions on it. And that was really cool because we got quite a few responses that were let us able to really glean some good information from them about, you know, what they wanted to see and what they wanted to see more of. So based on that research, like when we presented that research to you, what was kind of most surprising for you?
Well, I mean, there were things that were really surprising that we just didn't anticipate. But then there were also other things that you showed that were nice because they reinforced some of the strategy and messages that we were already using. Some of the things that came out, I think that were most important were the services that people most cared about, that we knew that they were donating because of that, was about our HIV services and food, and that donors stayed in touch with us mostly through social media, newsletter, and appeals. And that was really helpful, again, with being able to build out where we wanted to spend our time and resources moving forward. And many wanted to see even more communication from us, like more emails and more social posts, which again, we could be a little bit timid at times because we didn't want to inundate people. So that was good to hear. It also helped us know that donors wanted a combination of content related to statistics on our impact, but then also balancing that out with personal stories. And I think over time, we've always kind of gone in one direction or the other and not had a better balance between those two. And I think also that some of our donors wanted to be more involved in the visioning and strategic process of our organization. So again, just having donors be asked, how they want to get involved is something that can be difficult because you're not sure if you're asking the right questions, but having, another firm or, a third party come in and facilitate that was so amazing.
That's great. Yeah, thanks for that. I thought it was really interesting when we were doing some of the interviews, talking about the importance of those impact statistics. And we've heard that a lot, when we've done other interviews with other nonprofits. But one of the things that can be hard is, the metrics only say so much, right? Mm-hmm. There's a story beneath it too, these personal stories. And so how do you create messaging that has those really important statistics that donors want to see, but then also appeal to, the heart and the personal stories? Because I think that's one of the things with Lifelong too, is that it's not about kind of the quantity of care as far as the number of people you're getting through the door. What you all are really, really good at is the quality of care. So it's you're not just giving them any types of food, you're giving them culturally relevant and medically tailored meals. You're giving them certain kinds of services that really are treating the whole person instead of just one aspect.
Yeah, that's spot on.
Yeah. So once you kind of got the donor research, how did you use it, or how has it helped you in your work?
Well, it was perfect timing because we were getting ready for a leadership retreat at the beginning of this year. So the work we did last year with you all really built a nice foundation. And as we worked at the beginning of January to really hone in on our North Star as an agency and really look at next steps, that research, with that hard data, helped inform our team on how to build out a strategic communication plan that would better reach our donors in the way that they wanted to be engaged. And it's been huge when trying to make changes in our messaging and communication style, that we were able to have, again, that data that came from a third party, and it was very legitimate, instead of just having, especially as a marketing communications person, say, this is what I believe, this is my gut. But it's so much different to actually be able to provide the information that you provided. And when I was able to point to that, everything that you gathered, it helped to increase the buy-in from our leadership team. And it was undeniable. And we were also able to really see what was working with our ongoing strategies and where it was better to create and invest in new ones. So we didn't have to throw everything out and start from scratch. There was definitely some pieces that we were doing well, but we just knew then, again, as we're planning on our budget for this year, where did we want to try some of the things to really engage differently when we saw what donors had to say. And again, the project that you all spearheaded set us up to retain and grow our current donor base, while also reaching out to audiences that the donor research guided us towards. So it wasn't just, throwing out this net and hoping that we, will make some connections. The donors that you spoke to and the type of engagement that they talked about and what was important to them really helped us define on who we want to reach out to next.
Yeah. Oh, that's great. That's really good feedback for us too. And yeah, I guess the other, if there's other nonprofit directors or communications directors who are watching this that are maybe going through the story resonates, or they're looking to really up-level their marketing and communications, when would you suggest that a nonprofit invest in donor research? Who is this really good for?
I think folks that are in the same position that we've been in, you're evolving as an organization, which I think a huge transition is happening. And I think it's so relevant right now because we're seeing the landscape, especially after the COVID pandemic, change rapidly. And the needs of the community are changing. So many other organizations, especially that are social services or, connecting or, with schools or, within all the different populations that we're serving, things are changing so much, and you might feel stuck or just need to realign the way that you're communicating and with your community and with your supporters. So it's just, I think this is just a really pivotal time for so many people.
Yeah, that's really good. Well, kind of last question before we hop off, is there any advice, being in your role that you've been in for working at the organization for 14 years, which is a huge accomplishment. What advice would you kind of give other nonprofits who are at this similar transition point?
Sure. I think it's for all of us when you're in the weeds of your day-to-day work, with this organization that you love and adore, but we can all inadvertently have blinders on towards what a new direction could look like because we're just so invested in our mission. And we've been looking through this particular lens for so long. I mean, I know that's how I felt, but our perspective of what and how it needs to be messaged can be skewed, or off base. Especially when your support group has changed, over time, or needs to be reminded of the impact that you're making today versus who you were, 20, 40 years ago. So having someone, and fortunately we had you at Brilliant Marketing, but help with that deep dive into donor research, you can just receive a much better idea of what engages your audience and how to create a plan, for the long term, so that it really is not just a short-term fix, but you're really planning for your future.
Yeah. Oh, I love that. Well, we just had such a wonderful time working with you, and just a wonderful organization. And I hope that anyone who watches this video or is with us today will hopefully, look at their website and really see what they're able to do for the Seattle community. So just thanks for joining us today. Thank you, Sage, for being here. And if anyone does have any additional communication or questions about nonprofit communications or donor research, like please reach out to us or look on our website as well. We have some free resources there. If you are a nonprofit looking for communications work, there's some different guides and some trainings and everything like that. So we're here as a resource for you all. And thank you again. Thank you, Sage. I hope you have a wonderful rest of your day.
You too. Thank you so much.
All right.